Spinal Truth Show weekly podcast edition. I am your host, Dr. Caleb Slater, and I am accompanied by Chris, who is a human being.
Some would say.
Some would say. This week's episode is about breathing, asthma issues, and general breathing issues, right? Before we get started, please make sure to like and follow us on TikTok, Instagram, Facebook, YouTube, and we are also on Spotify if you're listening to this.
One thing I want to say up front, pumpkin spice.
You know what's funny is I just saw, I'll have to send it to you, but I saw a really funny clip about like the truth, if marketing were the truth. And
Nutmeg.
It has, right. I'm surprised you don't have a cup.
I usually do, but I was at my girlfriend's and then all my cups, I don't know. But so I stopped at Wawa and pumpkin spice was there, and I'm not like huge on it, but I thought that means it's fall.
No, it's way too early. You should not be allowed to have pumpkin spice until October.
It's fall now. It's September 1st apparently. We keep moving things. It'll either be Christmas or something else, and that's it soon. Like we won't have seasons anymore. But breathing is a big thing for most humans alive, but also I've been having issues breathing just because allergies. But
so there's a lot of reasons why you can have difficulty breathing.
Yeah.
But what a lot of people don't know is one of them could be your spine. All right. And I think it's the first or second chapter in my book. There's a chapter on asthma. Mm-hmm. And I had a friend who he was having trouble breathing. And it wasn't like pain. It was more of like a resistance, like inability to get a deep breath. And the more this went on, the more concerned he's starting to get about it. Mm-hmm. And he's doing the typical things like Googling and YouTube and stuff like that. And he's starting to kind of worry himself. His symptoms are worse at night when he's laying in bed. He's trying to prop himself up with pillows because he's thinking it might be an acid reflux issue. He's trying to troubleshoot it. It goes on long enough and it's starting to increase to the point where now he's getting really concerned. So he wakes his wife up in the middle of the night and was like, hey, we have to go to the ER. So they go to the ER, they run all the normal tests.
Which would be for?
So they're ruling out other stuff like EKG, so they're ruling out any type of heart issues. They're checking his vitals, blood pressure, heart rate. They did some chest x-rays, and I think they did some blood draws, right?
Okay.
Everything came back negative. The doctor at the ER said, sounds like asthma. Okay. So he then goes to his primary. Primary does the same thing, same tests, maybe a little bit more time spent with him. Maybe that's where he got his blood draws. I forget the timeline here. The primary says, I can't find anything, but it sounds like asthma. So we're going to send you to a pulmonologist. The pulmonologist should be the authority on this, right? Mm-hmm. Goes to the pulmonologist, does all of the testing. Now you do the high level testing. You're doing your VO2 max, you're breathing out, breathing in. They're actually measuring this. He tests above normal, okay? The pulmonologist diagnoses him with exercise-induced asthma, despite the fact that he says when he moves, especially when he works out, his breathing issues are better. But disregarding that information, the pulmonologist says, asthma, specifically exercise-induced asthma, gives him a rescue inhaler. Okay? He tries the rescue inhaler. He's listening to all the advice that he's getting. He's looking for his own, information, but he's also trying all the stuff that the doctors are telling him to do. It doesn't change it at all. Now it's worsening. Now he's getting referred to a cardiologist for a more invasive, intensive cardiac workup. He's about 3 to 4 months out from his appointment, and he's calling me to complain that about the medical system as a whole. And I say, he's asking me if there's anything that I could think of or do. And at this point, this is about 6 years ago, I had just been kind of seeing some of these vague symptoms that were responding to spinal treatments from, like a patient was coming in for their shoulder and I was treating their thoracic spine. And while I was doing that, their headaches were improving or their brain fog was improving or their, these other vague. I had just treated somebody that was diagnosed with Crohn's and I was treating their back and their GI symptoms completely improved, right? So I'm starting to kind of like look for this. So I told him, I'm like, all right, well, it sounds like it's acid reflux, but let me check you out. Let me look at how you move. Let me put some pressure through your spine. Let me see if there's anything. when I'm putting pressure through his spine, right around like T5-ish area, I press and he basically like jumps off the table. And I'm like, okay, well, now let's see if we treat this area, if anything changes. So, and we mapped out his breathing beforehand, you know, how does it feel? Is there any pain? How restrictive is it? I mobilize this area a little bit, sit him back up, have him retest. He's like, that's the first time I feel like I've been able to breathe fully for months.
Interesting.
And we're like, oh, interesting. So we treat it, his symptoms completely get better, and then we probably would have left it there. You know, again, at this time, I'm not necessarily, I didn't have the same mindset that I do now to like really look into the spine and see if this is causing or attributing like the symptoms.
Yeah.
He goes on this he goes on a work trip to Hawaii actually. And while he's there, he's telling his coworker about his symptoms, and his coworker's wife is standing right next to him and saying, hey, I've had all those same symptoms for years. It was like 2 to 3 years. Did exactly what you did, was told exactly what you were told, nothing's helping. So we get set up with her, and she's in California and we're in Pennsylvania. So now we're doing this over telehealth. And now we know a little bit more about what to look for and how to treat it. And so we go through a process, and then we give her basically what we gave him. And within a few weeks, she's off her medications and she's better. And we're like, shit, you know, now like something's here, right? It can't be a coincidence that the first 2 people I tried this with, you know, it was that effective for, and they were labeled with asthma or breathing difficulties, and it might not have been that.
Yeah. Well, there's a couple of things that came to my mind when you were recalling that story, his journey. Immediately, I thought of, because he was going down the YouTube or the Google rabbit hole trying to self-diagnose, there was an element of what is reality and what isn't. You know, is there anxiety to this?
Well, and I was just going to say, for a lot of people, they're going to get told that it's an anxiety issue. It's in their head. It's psychosomatic. Like we really, the pendulum swung so far into that direction recently. And I always forget the guy's name, but there was a guy that like really, maybe he was the final catalyst to this, where he's saying that like that mind-body connection where your brain remembers and you need to rewire your brain, and now you're doing all this cognitive stuff, and now doctors are putting you on SSRIs for your pain. You know, where they're basically saying, they're telling you that it's in your head.
It's in your head.
And I'm not saying that you can't have a psychosomatic component to your pain. That's absolutely possible. But if that's the case, you normally have had a traumatic event. There's normally something relatively big that's happened. You're normally stressed because of a big life event, a funeral, a wedding, moving, something like that, right?
Yeah.
That's giving you that. Or you had a previous trauma, and now you're like, you fell off a horse and now you're going back to riding that horse, right? But for a lot of people out there, we stopped looking for a physical reason, and we just are very comfortable with saying it's in your head.
Yeah. Well, if that's the case, usually when you're doing that Google MD search and you're starting to you start to justify like, oh yeah, this is what's happening.
Right.
But then when you go to a specialist or a doctor and they do testing and they do these and they see that there's no results, usually that lowers your anxiety, and you like think, okay, it's probably...
It lowers your anxiety to somewhat that they can't find anything.
Yeah.
But now you're like, well, then what the fuck's my problem,
yeah.
right?
Yeah.
And for the doctors, they want to give you a label. They're trying to help.
Yeah.
They're not trying to do anything like nefarious or for you, right? But they want to give you a label, and if you say I have a breathing issue, they're going to give you a breathing label. If you say you have shoulder pain, they're going to give you a shoulder pain label. You're going to have bursitis or tendonitis or rotator cuff issue or impingement, whatever, right?
Yeah.
And we don't look at your body as a whole. And my whole point, my whole reason of being on this podcast, my whole point of doing TikTok and Instagram and stuff like that, is that I have found that a lot of times these vague symptoms, or not even vague symptoms, a lot of times your pain in your knee or your shoulder is actually coming from your spine, and it's not properly assessed early on in the differential diagnosis. Again, you go for shoulder pain, they look at your shoulder. I think if you go for shoulder pain, they should look at your shoulder and then also look at the areas of your spine that could correlate with your shoulder. That's it. If you go for breathing issues, they should look at your breathing, they should do a chest x-ray, whatever, but then they should also look at your spine and see if there's a problem there. And we don't. And additionally, the way we would look at your spine would just be imaging, and we've talked a lot about this. Imaging's more inaccurate and misleading than most people realize. Thank you for watching the Spinal Truth Show. I hope you're finding this information helpful. If you're out there and you're still in pain and you're looking for relief, we have some solutions for you. You can schedule a consult with me or a session, but if that's not in the budget, we also have some options that are self-guided at home. You can go to thespinaltruth.com. We have courses set up right now for arm pain as well as for neck pain. They are geared towards you. They are a 4-week course, 60 videos that are self-guided by an expert in the field that you can do from the comfort of your own home at your leisure. They will take you through step by step the typical approach that I take with patients. The expectation is that they will provide significant relief over these 4 weeks. So if you're looking for something better, something different because you're not finding the relief, go to thespinaltruth.com, sign up for one of these courses, and get the right treatment, see the difference.
So let's take it back. Asthma, what is it? How is it typically diagnosed?
The way we talked about.
So I guess I'm not super familiar with what asthma is. Is it one of these catch-all kind of things, or is there?
Asthma is kind of an overarching thing, and then there's subcategories of different types of asthma. But for the most part, for broad strokes, most of the time asthma is treated with a bronchial dilator, so like a rescue inhaler. They used to be over the counter, maybe they still are. I think they've gone back and forth,
But is there a genetic component to asthma?
I'm sure there can be a genetic component to breathing issues, right? And again, so like breathing issues, it could be a sinus thing. It could be a sleep apnea issue.
Deviated septum.
Right, deviated septum. It could be a tongue issue. It could be so many things. The point is, it could be a spine issue.
Right, so for his story in particular, it's not that he had asthma, it's that he was diagnosed with asthma.
He was diagnosed with asthma.
Yeah.
And this is happening a lot. Like you get a diagnosis and rightfully so, you trust that diagnosis, right? You trust what the doctor is telling you. But the doctor is kind of under pressure to give you that term, give you a label, give you that diagnosis. And again, if you have a breathing issue, they're going to give you a breathing diagnosis.
Yeah. So this person, was he experiencing any sort of back pain or?
No, and so it's a good question because a lot of people are like, well, I don't have back pain. Like neither did this guy. This guy, very healthy, working out, active, relatively young, in his low 30s at the time.
Yeah.
Normal weight and height. Not having any issues other than the fact that he couldn't fully breathe in. And it wasn't necessarily pain, it was more of a restriction.
Yeah.
And a lot of people, even outside of this diagnosis, a lot of people that I treat, like so the GI patients that I treat, a lot of them are like, I don't have any back pain, or I used to have back pain, I don't anymore. But then when I see them in person specifically and I push on the individual levels of their spine, I mean, you've seen it.
Yeah.
If I put just a little bit of pressure on the problem area, they are jumping off the table. And they didn't realize how painful that was. And like you would think sitting in this chair right now, you're putting pressure against your spine, you would think that you'd have symptoms, but it's not focal enough. The surface area is too dispersed. And also your body gets kind of used to these symptoms. Your body gets used to a certain amount of pain. Your body gets used to compensating for movement. You have an area that's stiff and stuck, so you move with levels above and below, or you move with different body parts. Instead of turning my neck, I can turn my waist to look over my shoulder. Yeah. You know what I mean? Like I can adjust.
It's also a symptom of breathing problems leads to think there's a major issue going on, as opposed to, I got some minor back problem, pain.
And again, I'm not saying it shouldn't be troubleshooted, right? He absolutely should have had a lot of what he had done. But once they couldn't find anything, instead of just giving you a label of exercise-induced asthma, right? Or psychosomatic, where they're saying that it's anxiety. Before you do that, there's another step that you can take. And like what we said, imaging, it's flawed for me. How you move, when your symptoms are, what position you're in, and then maybe most importantly, just putting some pressure on the spine, centrally and unilaterally. So centrally on the spinous process, unilaterally on the facets on the side, right? Just putting that pressure on the areas that could be involved and seeing if you have pain or stiffness.
Yeah.
If you do, try treating that a little bit before you start getting onto medication, before you have invasive procedures, before you accept the diagnosis that you would have if you don't have a spinal problem.
So if Hollywood has taught me anything, it's that...
Which it's probably the main educator.
Main educator, honestly. In a lot of movies, it's always kids who have asthma. It's always a story element. Where's my inhaler?
I'm remembering Sidekick.
Yeah, there you go.
Chuck Norris.
Yeah, yeah, I do actually.
My Girl.
No, he had bees. Wasn't my?
Well, he had asthma. He had. Wasn't he? We're going back for the glasses. He had asthma too.
But the bees killed him.
But the bees killed him.
Macaulay Culkin, R.I.P. But
Macaulay Culkin's not dead.
Well, no, but he was in the movie.
Oh.
He's doing great now. He looks great. What?
He's not a great-looking guy.
Well, I don't know about that. I'm saying he looks healthy.
Oh, okay.
Yeah. I think he's fine looking. I don't know. We're not here to judge Macaulay Culkin's looks.
Not my type, if I had to pick.
That's fine. You're like an Alexander Skarsgård or something like that.
So Ryan Reynolds has been my number one for a while.
All right. He's just like the...
Idris Elba.
Well, of course, everyone.
Well, yeah. I'm saying
he
Macaulay
doesn't have
Culkin's
asthma,
no.
I'm sure.
Right.
But yeah.
No, definitely not.
But my point was that this guy you're talking about, yeah, he's not old, but he's not a child. Like he's not like.
Right.
Is asthma something that is often diagnosed later in life? Like you know.
So that's a good question.
I don't know.
Yeah, I'm not sure. You're right. Like normally, if you have it when you get it found when you're younger.
Yeah.
Right. When you start working out at gym and you realize you can't breathe.
Or you start playing sport. Yeah. So that's my.
So it would be weird that he hasn't had any issues throughout his life, but now all of a sudden he's developing it. But I bet you this is a good question to ask the people. Like when did you develop asthma or breathing difficulties? Was it young or were you older?
And do you know if this guy, I know you said he's active and he works out, did he play any particular sports?
In college he played rugby.
Rugby, that's a hard sport too. So,
I mean, you're getting
lots of trauma there.
Lots of trauma there, right? And so now for people at home, they might be thinking like, well, like what areas of your spine could cause asthma or breathing difficulties and stuff like that. Yeah, C3, C4, C5 innervates your diaphragm. So your mid-neck, very important for breathing, right? A lot of your thoracic spine, T1 to T5, has sympathetic and parasympathetic innervations to breathing, to your lungs. Okay. So it basically controls your automatic breathing.
Gotcha.
T1 to T11 innervates your scalene, your intercostals. So these are little muscles in between your ribs that help expand your ribs. They help breathe.
Okay.
You have some nerves that come out of your neck that go to muscles in your neck that help elevate the upper rib.
Yeah.
Right. Same thing. Nerves in your neck that go to your chest, your pecs that help control breathing. These are accessory respiratory. You have lower thoracic nerves that go to your abs that help with breathing and supporting your diaphragm. So there's a lot of stuff in your body, primarily in your neck and upper back, that controls your ability to breathe, your ability to take a big breath in or a big breath out.
So he was experiencing stuff even at rest, laying down.
At rest, well, and the funny thing is that he was treating himself for acid reflux by like putting a bunch of pillows and sitting up.
Which would aggravate it.
Which would aggravate his back. And again, so now it kind of made sense why it was kind of getting worse and worse and worse.
So how would acid reflux play into this then? Is that just a...
Well, again, it was just a differential diagnosis that was getting thrown around. Like,
gotcha.
Maybe if you're the acid coming up and aggravating the throat and...
But he was experiencing acid reflux as well.
I don't think so.
He wasn't sure.
I don't think so. I forget all the symptoms that he had, but the primary one was this like restricted breathing. Hey, just a quick break here and then we'll get back to the show. If you're out there and you want to see if this is the right approach for you, you can schedule a consult or a session with me. Go to thespinaltruth.com. At least set up a consult within 30 minutes. I will listen to your symptoms. I will go over your history. I'll go over what the approach I would take for you and the results that I would expect. My goal is to save you from continued pain, failed treatments, and prevent you from getting surgery. So go to thespinaltruth.com, set up a consult, and let me go over your symptoms. Now let's get back to the show.
So do you think there is anything that someone at home could do to kind of...
So that's a good question. Let me answer it slightly roundabout.
Okay.
One thing that I always preach is that if the treatment is the right treatment, the right treatment, the right area, the right dosage, whatever, it should work relatively quickly.
Yeah.
Relatively quickly means somewhere around 4 to 6 weeks, you should be at least or around 50% better, if not more. So one thing to take away from this is that, like, if you're getting a diagnosis and you're getting treatment from it, for the most part, right? There's always exceptions, but for the most part, within 4 to 6 weeks, if you're not noticing significant improvement, now you need to start thinking, all right, did I get the right diagnosis? Am I getting the right treatment?
Yeah.
Okay? Some things that you could do at home. That's a tough one. The main exercise that this guy did that really helped was the foam roller that you see all across our page.
Yeah.
Right? So I don't want to suggest trying that, because you should be consulted by somebody directly, either with me over telehealth, where I run through your history and make sure this is appropriate for you and stuff like that. And again, for some of these symptoms, like if you say I have a breathing issue, if that needs to be thoroughly vetted, for the more serious conditions, heart conditions, what blood pressure, all that stuff, right? Chest X-ray to rule out some type of pneumonia or a lesion on your lungs or cancer or something like that, right?
Yeah. Do you think there is a benefit to working on this area of your spine, even if you're not quote unquote diagnosed with asthma, but like we said, like deviated septums or like anything like that? Like this?
I think there is. So a lot of people don't realize how much your posture affects your breathing. But I mean, like if you were to like bend forward, right, and really try to take a deep breath in, it's a lot harder.
Oh, I'll just die.
Yeah, it's a lot harder than if you're sitting up nice and tall. And for most of us these days, we are only sitting looking down, right? Yeah. And that actually really taxes your neck and upper back in one direction all the time. And that actually does put some pressure onto your lungs and your diaphragm, and it does restrict your breathing by stiffening your spine. So a lot of us, the foam roller, that should be a part of, honestly, we should teach it to kids in school. I try to have my kids, and you know how it is by telling your kids to do something.
Yeah.
I actually try to have my kids do the foam roller before they go to school and once they get home. And we've talked about this a little bit. There's this what's the best posture?
Yeah, exactly.
There is no best posture. The best posture is moving.
Yeah.
If you want to make it maybe a little bit more specific, the best posture is moving in a direction that you don't often move into, or the direction opposite the direction you're always moving into. And for most of us, that's leaning forward, looking down, and rounding your upper back.
Yeah.
So the best position that you can do if you're really trying to work on your posture is move in the opposite direction of that, and that's the foam roller.
When he was being diagnosed with asthma, did he think that it sounded right to him? He
questioned, especially at first he was taking the asthma, because
so what was that? What was he taking?
A bronchial dilator. What's in a rescue inhaler? I'm blanking. Albuterol.
Okay. So he would take that a couple times a day?
Yeah, and specifically after he was told it was exercise-induced, he'd take that before he worked out.
Does that lower inflammation in your lungs? Or
it dilates your bronchioles in your lungs to help with respiration, to help with oxygen exchange.
And he noticed no difference?
No difference. So again, if it was exercise-induced asthma, this inhaler before exercise should have had some effect.
Yeah.
No effect, right? So. And it's tough because this happens a lot. So much more than people realize.
Yeah, it's. I was just curious because we've talked about that before. It's like, if you feel like that diagnosis isn't sounding right, then maybe it isn't. Not to say don't trust the experts, but.
Well, maybe get a second opinion. The problem with the second opinion is they have the same tools and training and outlook that the previous person did for the most part. And then additionally, that word, that diagnosis is going to get to them somehow, either in your chart or you're going to say the previous person said it was asthma, right? And that's really going to give them tunnel vision into looking and into giving you that same diagnosis.
How do you feel about the people who have to use the, I forget what they're called, the machine?
The face mask, the CPAPs?
Yeah, CPAP.
Again, there's a bunch of different reasons why you would need the CPAP. For better breathing at night. Most of it can really be fixed through diet and exercise.
Gotcha.
You know, number one is proper weight, and then number two is probably this, like getting your spine to move, being active. And for most of us, and for myself included, like I try to work out 3-4 times a week. You know, I try to, when I'm at rest, I try to rest in positions that aren't bending forward. You know, we just talked about that earlier today, right? Where I'll lay across like a pool noodle to extend my back a little bit. Doing some weird things at home, right?
All kinds of weird stuff.
All kinds of weird stuff. But even then, like, I'm sitting here right now on this podcast, bending forward. I'm gonna probably do this. I have 2 telehealth patients today. Then I'm gonna do this the entire time.
Yeah.
You know, how many hours am I spending in this position versus how many hours am I spending in the opposite position? There is a big difference.
Yeah. A lot of my breathing stuff, I went to an ENT before. I have a very deviated septum. I don't want to do the surgery because it sounds awful.
I've actually had the surgery.
How was it?
It was okay. Yeah,
Okay.
it wasn't bad. I've been told that, like, depending on how or if they need to pack you afterwards, that might increase the discomfort. But that being said, my septum's now deviated again. And now I'm not doing it.
Yeah. Well, they tried to put the camera up to one side, and they were having real trouble, and then they finally got it, and they're like, you might want to consider and I was like, I don't want to do that. But, you know, all my life, because of that, I felt like sometimes sleeping, like I didn't want to sleep on my back because I didn't want to breathe through my nose all the time. Like I would feel like it would wake me up and stuff. I don't know.
My wife loves this book called Breathe.
Breathe.
And it's the guy that was basically started a whole bunch of that, like taping your mouth shut at night.
Really?
James Nestor.
It sounds like she's trying to have you die in your sleep. That's what would happen to me.
There's been some talk of that, not necessarily from my wife, but yeah, definitely from my wife. But about this whole process of like taping your mouth shut and should you or shouldn't you and stuff like that. And again, for me, right? You rule out if you find anything that jumps out, then you examine that. If you don't, the next area. Honestly, it should be your spine. We just talked about it's anywhere from C3, so your upper cervical area, your neck, right around where your earlobe ends, right, to T12. So pretty close to belly button level.
Yeah.
Right? That area of your spine sends signals out to something that helps you breathe.
I wish, like the method that you have somebody you can just touch a part of their spine and see immediately if they're having an issue there. I wish there was a way for people to kind of do that on their own at home.
Yeah, I mean you can have your partner or something push on you, but
it's not going to be.
It's not the same,
No.
and it's not probably a good idea.
No.
I mean, I'm putting a solid amount of pressure through people, and what you should feel is you should just feel that pressure.
Yeah.
But if you feel pain, now that tends to mean there's a problem in that area.
Yeah. All right. So what do we say to the people out there who may or may not have been diagnosed with asthma, are having breathing issues, not seeing any results? Maybe they're taking the ibuterol, still not seeing results.
Yeah, is that there's another possibility. There's another thing that still could be done, that if it is the case, it's relatively easy to find, it's relatively easy to treat, and if it works, it is actually treating the underlying cause.
Okay, so let me ask you this because we get comments a lot. Are you suggesting that asthma is not a real thing?
No.
Okay.
No, not suggesting asthma isn't a real thing, but I'm suggesting that breathing difficulties that would look a lot like asthma and get misdiagnosed as asthma or other breathing conditions could be an actual spinal problem, and it's rarely looked for. If it is looked for, it's not looked for well. Again, primarily imaging, x-rays and MRIs. And if it is a problem, it's treatable, right? Like,
exactly.
That's simple. And I don't know why we get so much pushback with that mindset.
I mean, there's a mental component to being diagnosed with something and feeling like once you go through that whole rigmarole to think that it was that simple the whole time, like there's got to be some sort of component to it where it's like, it's not this simple. Like, I didn't suffer and go through all
Right,
this.
for this.
Yeah, like, I'm definitely...
I get that, and I get, I'm some random guy on the internet telling you this, that you've never met. You didn't seek my counsel, and you're listening to this, but you didn't seek my direct advice.
Yeah.
You went to a doctors, or a specialist, and they gave you this information. But I'm telling you, I have seen so much misdiagnosis once I started this like spine-centric approach. And again, if you come to me with an elbow issue, I look at your elbow. I ask you questions about your elbow and your elbow symptoms and when it is. But before I treat your elbow, I also look at your spine.
Yeah.
And I do this with every condition that I treat, is I ask you about your problem, but then I look at the correlating area of your spine and I see if there's an issue. And I am amazed, shocked, irritated, whatever, for how often this is the case.
Yeah. All the people that I know who have been diagnosed with fibromyalgia or Crohn's or any of those kind of conditions, it becomes an extremely big part of their personality and life.
And for both of those that you just mentioned, remember there is no test that rules in Crohn's, or there is no test that rules in fibromyalgia. It's a cluster of symptoms, it's a cluster of findings, and then it gives you the most likely diagnosis of Crohn's, the most likely diagnosis of fibromyalgia. Basically, we couldn't find anything else to confirm anything confirmable, but you have these symptoms, it seems a lot like Crohn's.
Yeah.
And that is the case for a lot of conditions out there. A lot of conditions out there are kind of a diagnosis of exclusion, and then you're left with whatever that doctor's experience has been, or who trained them, or what population they generally treat. Now their biases, and this is everybody, but their biases and their tendencies, and they're gonna give you a label. And now, like what you said, now that label becomes you. It becomes, this is how you act. This is how you eat. This is, it affects your sleep, your eating. It affects you going out. Like this label now becomes ingrained in your life. And yeah, so maybe it is hard to get out of that. But for me, if I'm having a problem and somebody is saying, hey, give this a try, and it might fix your problem, I'm going to do it.
Not everybody's like that.
Yeah, and I get being tired of maybe the hope, being tired of trying something new, I do get that.
Yeah. Yeah, but irregardless of any of that, like you're saying, specifically the foam roller exercise just seems helpful for just this modern day lifestyle.
And you asked, and maybe I should answer this. If you really want to try something at home, again, the foam roller. But one thing that you might notice when you first do the foam roller, it'll be really, really painful. Yeah. It'll be painful, you'll be stiff, you won't be able to get your head down to the ground. When you come off of the foam roller after doing it a few times, you'll be like stuck. If that's the case, that's probably your sign that area is involved. Because it shouldn't be. It should be pleasant. You should bend over it and it should feel like a nice stretch. You should be able to get your head down to the ground. When you're done doing the foam roller, you should be able to pop right up and probably feel a little bit better. But for a lot of people, especially when they start it, that is absolutely not the case. It is painful, it hurts, they feel stuck. And when that happens, I tell people, look, this is your sign that you need to do this.
It's just like any kind of exercise, it seems like. Like I walk a lot with my girlfriend, she does so much walking, but there'll be days where like I haven't walked for a while, like haven't been very active, and then I'll meet with her and we go for a walk. I'm like, oh my God. But then after a day or two of doing it, it starts, right back. I'm like back normal. Yeah. Yeah, it's the start of anything like that.
But what if you went 10 years?
Years, yeah.
Right?
It's not gonna be easy.
When's the last time you really looked up? Right? Yeah. Seriously, like when during your day,
it's not a normal,
do you really look up? Kids playing, they're doing somersaults and back bends and stuff like that. But especially as we get older, when's the last time you really looked up? And how much throughout your day are you looking down?
Yeah. If you're out there, just think about that.
Yeah. Again, the whole point is it's worth a shot. especially if you're not seeing results.
100%.
All right, well, that's our show for this week. Hopefully we answered some of your questions. Hopefully we gave you a little bit different of a mindset on what to think about for maybe breathing issues or asthma or maybe some other conditions that you weren't aware could be misdiagnosed and could be a spinal related problem. Make sure to like and follow us on TikTok, Instagram, Facebook, YouTube, Spotify, whatever. And make sure to stay tuned next week for another episode.
Exciting tease of the next week's episode.
Yeah, it is, right? It's some episode that has some health topic.
There you go. Look forward to that.
Right?
All right.